It doesn't add up to 400 billion, by any stretch. And they can't define where that fraud and abuse exists. They don't even know where to go look for it yet.
Well,
right, otherwise they would have gone ahead and solved it.
I think it's important to point out that you can read, for example, you can read, I don't remember the guy's name, but he publishes a book on, he's a healthcare consultant. Mm-hmm. And, I have to tell you, I read that book and I think, well, what they're talking about is his advice to doctors, and I'm not suggesting that all doctors follow it, but this is what the consultant's writing to do, and that is to always bill a step above the first, whatever, I guess Medicare is broken into levels.
The codes, right.
And he says, bill one code above. That's fraud and abuse. and I think that's part, and that would be a big part.
It's very
depending on how widespread that is.
When was that book written?
Well, he's still out making, I don't want to talk about the context, but I've seen him make that presentation within the last
So let me give you the flip side of that. Most doctors undercode, and that means that they don't want to have any scrutiny by either an insurer, private or government, to come look in my books. We undercode. Actually, doctors are leaving money on the table, except for the crooks. And here's the other flip side to the flip side. These electronic medical records vendors, I just spent $250,000, the collective of my office, on an EMR program. What they tout out of this is that if you will put check marks by a box and generate for a 4 or 5 minute visit a report that this is this long, which is total mumbo jumbo and means nothing, your bill can be not $55 but $72. That's fraud and abuse. That is nonsense. And that's what Obama is basically requesting that I do with this electronic medical record. I don't do it that way.
Well, let's be fair. I can say that electronic medical records are a good idea without endorsing the abusive recommendations of a particular vendor. So, I think that's part of it. I think that's why we're having such difficulty here. I think our political system has broken so that we can't really sit down and have a conversation about what the underlying cost drivers are and how to address those. We always break, the conversation always degenerates into, well, do you want the government to take over this?
Right.
Telling stories of abuse. We know what the broad cost drivers are, and the question is, how do we address them? And if both sides would come to the table, there would be good ideas on both sides.
The challenge is we're not addressing the cost drivers.
That's right.
Right now, we're addressing the easy target. Now, are there places that need to fix? Oh, you bet. But there are easy fixes that can be done with minimal additional expense. We streamline, we eliminate a lot of the hassle factors. If you took a legal piece of paper and you wrote down, as a patient, what are the things that just irritate the fire out of me the most? Well, we could fix those just real easily. I wanted to take a second to go back to your observation, because it's a fair observation about what would happen if we used CMS or Medicare reimbursements across the country. Wouldn't that standardize the market?
or some other approach to standardize the market.
Exactly. Challenge number one is Congress loves to pass a budget once a year. We want them to pass a budget. And every single budget, they change Medicare reimbursements. So you've got this constant wave and push-pull, and then the lobbying position comes in, because they'll come in one year and say, well, we're going to change reimbursements for primary care. Well, the primary care doctors are up there on the hill, and then the next year they're going to go after the specialists, and then the following year they go after the hospitals. So it's this constant tidal wave of political push, which is what our system is built on. But you have this running argument every single year. Nothing really stays in stone. So it's hard for individuals that are business owners, which providers are,
well, and part of what we're doing
to stay in business.
Part of what we're doing here tonight is, I'd have to say as a psychologist, that we have a mechanism of very sophisticated social engineers out there who can drive the media to present messages, like, for example, your issue of fraud. That's just a small part, but it bleeds, so it leads. And that's the one where I was watching a 60-minute show this weekend, and they're talking about that you have Medicare has a requirement that they can't delay payment of a bill by more than 60 days.
Correct.
So what happens is they set up these fraudulent medical equipment places and home health and things that just bill the bejesus out. They get the money, and then before they can catch them, they're gone. But yet, is that really that much of a problem? But the thing is part of us sitting here now is that we've got some different opinions, but we're talking. So, and my concern is that when I go home tonight, that I'll sit there and I'll flip between, Keith Olbermann and Bill O'Reilly. And you get two different spectrums, and I try to figure out where the middle is, because they both, I believe, cater to a group that, before, we've always had kind of...
They cater to ratings.
Well, they cater to ratings, and see what I would say is, as a person who's an expert in crazy, that used to be crazy, kind of lived in all sorts of places, but now the internet, they get organized. And our politicians know
dynamics
that
are very
I'm going to play to my base. And so the thing is, like, even as the county chairman, how do you keep a dialogue going when there's people screaming on either end?
First, you have to take out the factor of the people you just mentioned are in a business, and the business is called entertainment. If you think that, you just said, if it bleeds, it leads, well, if it doesn't get you irate and upset, it's not going to get viewers. And so you have two totally divergent views on either end, with fans of either, and you don't have, you ask people today, what are you watching? It will either be one or the other. And so, and you never see a merging of well, maybe there's a bit of this and a bit of that, and maybe there's a happy middle, or at least a solution in the middle, like you would see in your line of work. Extremes are never where the solutions are. They're always where the antagonism is. And so you've got to get away. You've got to turn off the TV. You're not going to solve the problem there, because that's just raising the energy, turning up the heat, getting a little boiled. What we've got to get back to is, where are the solutions in our country? And they are not in the government. They are in the private sector. They are, if you want to streamline supply chain in medical, well, who's the best supply chain management in this country right now? The word Walmart come to mind? They've got the #1 supply chain on the planet. They've got just in time like nobody else. Where's the conversation of having the private sector, like FedEx, talk about how they get a package from one side of the globe to the other, and it never gets lost because it's trackable? Where's that conversation of, could we bring that into the healthcare business? About your state lines, we are in a world today where we've got to respect state rights. But you cannot tell me that there could not be a transparency, a total transparency, and so that everybody could say, look, there is a reality of cost of healthcare in New Jersey that can be overlaid on Texas, and there can be a comparison and a differential applied. But here's the #1 thing. You said this earlier. We are targets. The insurance providers are targets in this debate. Maybe disproportionately. The solution we are trying to find is, me, the patient, get to the physician. And we need as little resistance between that in order to get good health care. If it's health care we're talking about. Now, if this is just a ruse of, we're talking health care, but we really want a takeover of the government, because you cannot compete. The health care providers and the insurance will not compete with the United States government in the end. We may look at it at the beginning of the conversation, we're going to try and have a morphing of the system with insurance options, but then the government will be over here. We will eventually see the government is the winner, and they will have all of the policies. It will have to go.
And within that, though, is part of the